Every year, from January to March, fourth-year students from the Medical School for International Health complete a capstone Global Health Clerkship in an under-resourced clinical setting. The goal of this clerkship is to allow MSIH students to experience the practice of medicine in an environment other than their own, while working in various conditions affected by the economics, traditions, religious beliefs, limited resources, and geography of the local area.
Sri Lanka has seduced travelers for centuries. Marco Polo described it as the finest island of its size in the world, while successive waves of Indian, Arab, and European traders and adventurers flocked to its palm-fringed shores, attracted by reports of rare spices, precious stones, and magnificent elephants. Poised just above the equator amid the balmy waters of the Indian Ocean, the island's legendary reputation for natural beauty and plenty has inspired an almost magical regard even in those who have never visited the place. Sri Lanka's population of 21 million is a mosaic of different ethnic and religious groups, the two largest being the mainly Buddhist Sinhalese, 73%, and the predominantly Hindu Tamils, 17%. There are also considerable numbers of Christians and Muslims. Sinhala, Tamil, and English are all officially recognized languages. The country has had a functioning democracy since independence and in 1960 elected the world's first female prime minister.
Sri Lanka is on the forefront of the Millennium Development Goals agenda. It has already achieved several MDGs, especially in the health and education sectors. Sri Lanka has also made great strides in poverty alleviation, child and maternal mortality rates, and gender equality. Sri Lanka is on track to achieve the targets for most of the indicators by the end of 2015. Sri Lanka has the lowest maternal mortality rate in Southeast Asia, and the country has achieved considerable success in reducing maternal mortality. At its current level of 11 infant deaths per 1,000 live births, the infant mortality rate is lower than that of many other countries that are considerably wealthier than Sri Lanka. Our group was based at the Anuradhapura Teaching Hospital, whose catchment area covers the entire North Central Province, as well as border areas of the adjoining Northern and Western provinces. Altogether, the hospital covers as many as 2 million people. Anuradhapura Teaching Hospital, a 1,300-bed facility, has all the major specialties represented, including medicine, surgery, intensive care, and even a large renal unit. We've rotated through several wards during our hospital month, including the adult male ward, OB-GYN, called Gyn Obs in Sri Lanka, pediatrics, and surgery. We joined the Sri Lankan medical students in history taking, physical exam, on rounds, and in didactic lectures. We also accompanied rising fourth-year medical students on home visits in nearby villages. We visited local schools, rural hospitals and health centers, as well as an SOS children's village. We assisted in health inspections, vaccination campaigns, and antenatal clinics. When we arrived in Sri Lanka, Dr. Agampodi, our preceptor, informed us on how there was a leptospirosis outbreak going on in and around Anuradhapura, which was the town that we were in, as well as the surrounding villages. When he learned that Julie and I both had masters in public health, he got very excited and said, "So you'll be running the outbreak investigation." Over the course of the next 2 months, we worked with around 12 medical students and a group of doctors, and we administered exposure questionnaires to 3 hospitals as well as the main teaching hospital, and also did chart reviews in some of these satellite hospitals. We have written up these results and have submitted 1 paper so far to a local journal.
In the course of our trip in Sri Lanka, I had a really eye-opening experience during our first week in internal. Earlier that day, I had seen a guy who had come in for end-stage liver disease. He had alcoholic cirrhosis, and he was coughing up blood. He had all the signs of somebody who was probably not going to last very long. But it never occurred to me that he might actually die right there in the bed that he was sharing with somebody else, because they didn't have enough beds for each person to have their own. So all of a sudden, I noticed that there were a bunch of people running over to that area, and they had drawn a curtain. And it was really familiar, people doing compressions. I'd seen it before. We saw it when we were internal here in 3rd year at Soroka. And that went on for maybe like a couple of minutes or something. And then the attending came, and I just remember seeing him from the back standing there with his hands on his hips and just very softly, because everyone speaks so softly there, motioning for everyone to stop. And All the residents took a step back, everybody left the scene. And we asked one of the students, we're like, what's going on? And they said, well, they know that he's not gonna last very long. He's not gonna stay in an ICU. They're not gonna be able to care for him. So the attending just decided to let him go. And he talked to the family. The family knew, everyone was informed. But it was the first time that I'd seen a doctor actually make that call and let somebody die instead of trying to keep them alive. Usually we do everything we can. That's the credo. That's like our motto as physicians, is do everything you can. To see people be so comfortable around death and really be able to take that experience as one to learn from and not something to be sad about, but instead to see it as something positive that they could use in their own education was not something I'd ever experienced.
Living in Sri Lanka put us in touch with a lot of believers in Ayurvedic medicine. It's very interesting to me because it's one of the oldest medicines and it's a natural healing and something that as global health practitioners we have to be aware of and oftentimes work with. We actually had the opportunity to stop by this Ayurvedic farm where they were growing natural herbs. They grew stuff like cinnamon, basil, licorice root, chilies, you name it, and people would extract oils that were said to heal anything ranging from hemorrhoids to joint pain.
For me, I feel like the best part of our experience, honestly, was the Sri Lankan medical students we met. They're so committed to medicine, to studying medicine, to being practitioners in Sri Lanka. But they're also just the nicest people, like they took us on trips to various places. They introduced us to parts of the country that are kind of their part of the country. It wasn't some of it was tourist stuff, but it was just really their lives, and they invited us into their lives, and it was just so amazing of them. And for me, that really made the experience. Clinically speaking, I think the most valuable part of the experience was the time that we spent in the community health part of the elective. Honestly, being in the hospital, it was interesting. It's a little bit different, but the community health part of it was really a great way to see what the country was like, especially being able to go to antenatal clinics in the periphery. We could help with vaccinations at schools. We could help doing health screenings for teachers at the schools, that kind of thing. And for me, that made me feel useful and so made the experience more valuable. One of the most impressive things for us about Sri Lanka, just in terms of their health system, is how well they do health on a decentralized level, how well they do the community health aspect of their whole system. And being able to see it firsthand was really great for us.